Hi. So when someone comes into my office and they say, Doctor, I'm fatigued, and I look at them and let me just run through you what goes through my mind when I'm evaluating someone for fatigue. First, I kind of say, when did it start? Were there any events surrounding the time of it starting? How long has it been going on? And I'll tell you why that's important. Well, if they're coming in and say, like, my wife died, my dog died, my kid just got diagnosed with leukemia, okay, a stress in life makes you fatigued. So that right there is a giveaway, where I lost my business, I lost my job, I'm having financial difficulty, my wife's leaving me, my wife's having an affair, my husband is having an affair. So that would be kind of major indicators of what's causing fatigue. But then I'm looking at them, and if they look pale, some people don't have a redness to them in their skin color, and I think, well, maybe you're anemic if they're really pale. So I've had a few people come in, and I said, just do a critical blood count, which is CBC. We look at the hemoglobin, and we look at iron levels, and if it's low, it's a simple fix. It could be dietary, it could be an iron supplement. They could have some really bleed somewhere in their gut, or some minor bleed, or they're menstruating too much. But we correct that, and the edema goes away. A lot of times they're coming in, if they're huffing and puffing, it could be anemia, but a lot of times it could be emphysema, chronic obstructive pulmonary disease. I said, that can cause fatigue, congestive heart failure, where your heart's not beating enough blood. Anything that doesn't allow oxygen to get to your brain, causes fatigue. That's common, actually, that I see the anemia and the heart and the lung problem. But also I see people come in and say, I'm fatigued. I'm like, well, you work Amazon warehouse shift manager at night. Hello, that's why you're fatigued. You throw off your sleep-wake cycle. I have sleep apnea and I don't use my machine. Yeah, well, you'll feel fatigued. You won't rest. You don't sleep, you feel fatigued. So a lot of people have sleep apnea. That is very common. I don't know if it's just more common today, but I just see it a lot. So sleep is critical. If you're not sleeping, you're fatigued. I get some people sleep too much. They're fatigued. You sleep too little. Disrupted sleep, multiple wakings. People with panic disorder, they wake up, they don't sleep. They get fatigued. Depression gets fatigued. It's just your body shuts down in depression, you feel fatigued. I get people with anxiety disorders. They worry, can't relax, they get fatigued. I get people jerking their legs at night. Restless leg syndrome, you can't get any rest with that. What's going on during this COVID time period? People with just bored out of their mind. They're fatigued. Someone who's lost someone, grief, that causes fatigue. Well, here's a big one. Not enough exercise, you'll have fatigue. You need to exercise to keep your body going. But now I got some guy comes in today, I'm training for a triathlon, I do it every day. And no wonder you're tired. Hello? He's running, lifting weights. Also, there's some obvious things that cause fatigue. You smoke crack, then you stop, you're fatigued. You do Xanny bars all day, Xanax, you'll feel tired. It makes you tired. Drinking causes fatigue. Marijuana, opiates, benzodiazepines, barbiturates. You smoke methamphetamine, crank, and then you stop, you'll be fatigued. Hypercaffeineism. If you do caffeine all the time and don't sleep, eventually the caffeine won't work, you'll feel fatigue. There's chronic infections cause fatigue, like if you have a chronic tooth infection, urinary tract infection, a chronic low-level infection of a virus, a flu, that can cause fatigue. Dehydration. You don't drink enough water and keep hydrated, you'll experience fatigue. Food allergies. If you have gluten allergy, lactose intolerance, and then you're always eating the wrong thing, and then you're not sleeping, that'll cause fatigue. Serious illnesses like cancer treatments, people going through any type of chemotherapy, biological treatments, it can cause fatigue. Medications that are used for blood pressure, seizures, anxiety, depression, they in themselves cause fatigue. So you have to look at the medications they're on, Diabetics, poorly controlled blood sugar causes fatigue, nutritional deficiencies, electrolyte abnormalities like potassium or sodium, vitamin deficiencies. Big one is thyroid disease. Low thyroid, fatigue. Another big one would be low testosterone, both in men and women, and high estrogen in women causes fatigue. Fatigue is a symptom of many other illnesses. That's the point of this. So think about everything. I've seen chronic smokers get fatigue. But that's the gist of it. I tried to cover the major ones that I see. I'd appreciate if people would subscribe to the channel, Dr. Mark Agresti, my YouTube channel. I need more subscribers. Help a brother out. Thank you very much.